Hi friends, welcome to Origyn, Fertility and IVF. I am Dr. Rashmi Sharma. So today let us discuss, is your decision for doing the IVF correct or not? Or is it the right time for you to do IVF or not? Because many patients come to me with this question and they are really puzzled. So let us dissect it one by one. How do you decide whether your case is right for IVF or not? The most important thing in decision about IVF is what is the indication for IVF or what is the reason for your infertility. Second decision is your age, how old are you? Third decision is what is the duration of infertility, how much time it has been that you have been married. So if we look at the indication for IVF, there comes the role of why infertility is happening to you. So there are certain absolute indications for doing IVF and there are certain relative indications for doing the IVF. Among the absolute indication, if your tubes are blocked totally, there is no way that you can conceive by natural try or IUI unless a miracle happens. So that means you have to proceed to IVF, whatever your age. Do not waste time. So believe me, I have seen patients who were diagnosed with bilateral tubal blocks at the age of 25 and they didn't do IVF till the age of 35. So as you know, IVF is not 100% successful. IVF success also depends on the female's age. So if you have been diagnosed with bilateral tubal block, what are you waiting for? Go ahead with IVF, whatever your age. Second, very important absolute indication is if the husband's sperm count report is very low, very poor. So we know for fertilization of the eggs naturally you need millions of sperm. So if the sperm count is consistently low, let's say you have done 3-4 tests and all the time the count is very low, the motility is very low, or the shape is very low, there are not enough sperms for natural fertilization, then don't waste too much of time, go ahead with IVF fixing, right? Another indication is if you are going for pre-implantation genetic testing, that is PGT, for any genetic abnormality. So of course, if you have some genetic abnormality which you want to rule out in the baby, you will have to do IVF only. So these are the indications where there is no other choice, whatever your age may be. The other indications may be where other procedures have failed, like normal tries have failed, IUIs have failed. One of the procedures, one of the indications, very important indication may be severe endometriosis. So if you are suffering from endometriosis, you know endometriosis is a progressive disease. It's a disease which is not going to which is not going to disappear. So if 1 or 2 IUIs have failed, if you have open tubes, then go ahead with IVF. Same with PCOD. If you have PCOD, you have tried 6-7 times normal try, IUIs and nothing has worked for you, go for IVF. Same is with unexplained infertility, where all the reports are normal but you have tried everything and failed in everything, then it's better to proceed to IVF because IVF offers a very good amount of success rate. And yes, when should you do IVF also depends upon the age. Sometimes when the age is high, then the decision should be faster. Also, what is the duration of infertility? So if the duration of infertility is very long, so you have been trying for 5 years, then what are you waiting for? Enough. 5 years is more than enough. No, I would say in unexplained infertility where all the reports are normal, even 2 years are more than enough. In that also you have to see that you do not lose too much of eggs, right? If your ovarian reserve is normal, then only you have to wait for 1 year or 2 years, otherwise you have to proceed to IVF. So take the decision of IVF timely. Sometimes this indecision about doing the IVF, that let it happen naturally, may become a big cause of regret. Don't delay it. If you have the indication, go ahead with it. Thank you.